They told me mom's going home with home health, but she still can't walk on her own. How's that safe? Sound familiar? You're not alone. I'm Sondra, RN case manager with 20 plus years in elder care, and today I'm breaking down the real difference between going to a skilled nursing facility for rehab and going home with home health care. Because the truth is, families are often expected to make this decision without fully understanding the risks, benefits, or even what either option truly means. Segment 1: what SNF rehab actually is. A skilled nursing facility, often called a SNF, is a short term rehab stay covered by Medicare if your loved one meets certain criteria. This isn't long term care. The goal here is to help the patient recover enough strength and function to return home safely. What SNFs provide: daily physical, occupational, or speech therapy at least 5 days a week, 24-hour licensed nursing care, help with all activities of daily living like dressing, bathing, and mobility, and medication management with close monitoring. Section 2: what home health care actually includes. Home health care is skilled care too, but it's delivered intermittently in the home. What home health provides: nursing visits 1 to 3 times per week, physical therapy, occupational therapy, and speech therapy 2 to 3 times a week, home health aid only a few times a week, and not always. This is meant for patients who are medically stable and have someone at home to help them in between visits, or are medically stable to be home alone. It's not 24/7 care, and it doesn't replace full supervision or mobility help. Segment 3: when SNF is a safer option. Choose a SNF if your loved one needs daily therapy to regain function, can't get out of bed or use the bathroom safely without assistance, has wounds or IVs that need daily close monitoring, or lives alone or doesn't have consistent home caregivers in the home. SNF gives them rehab every day and ensures nursing staff watching for complications and progress are available 24 hours a day. Segment 4: when home health care can work. Home health is a great option when the patient is motivated and cognitively intact. They have family or paid caregivers available to help daily. They can safely manage stairs, the bathroom, or transfers with minimal support, or the home is already equipped with grab bars, mobility aids, and emergency plans. Segment 3: what families often don't know. Home health doesn't show up every day. There can be gaps in care. Medicare requires certain documentation to approve SNF, even if you think it's needed. If your parent is refusing therapy, is unstable, or is declining quickly, home health care might not be enough. If you're not sure, ask, is my loved one safe at home with this plan? If the answer isn't clear, request a care meeting before the discharge. Download my free Caregiver Clarity Kit at luminalife50.com. It walks you through what to ask before discharge, how to understand SNF versus home health, and how to document concerns so you're not dismissed. This kit is based on what I wish families knew before they were handed a discharge plan. Don't let guilt make the decision. Let the facts guide you. You're not giving up on your parent if you choose a safer option. You're being an informed caregiver. If you've ever been blindsided by a hospital discharge, just whisper, "Me too," in the comments, because you're not too late, you're not too old, and you are not alone. I'm Sondra, and I'm so glad to be taking this journey alongside you. I'll see you soon.